Hi, I'm Faith, and this video is going to discuss some basic baby wearing safety. A lot of times when I'm working with a new caregiver or a new baby wearer, they might be a little bit nervous about being able to do so safely, maybe lacking the confidence to try it themselves without worrying about putting their baby in danger. So what I often tell these people is that there's really just two things that you need to remember in order to wear your baby safely. The first thing is that you want to protect your baby's airway. And this is true not just in a baby carrier, but also in car seats. That's why a lot of car seats have a little bubble on the side to maintain the proper angle. It's true in bouncy seats and swings, and even holding your baby in your arms. You always want to make sure to protect their airway. A newborn baby's airway is about the size of a drinking straw. So if the baby's chin falls against his or her chest, that can lead to a kink in the airway, which can cause labored breathing. So a good way to make sure that you're keeping your baby's airway open is to test 2 fingers between the chin and the chest. And if you can fit 2 fingers between chin and chest, then that's a good sign. That means that their airway is open. If you ever hear your baby making sounds in a carrier that indicate labored breathing, maybe grunting or snoring or any other sound that's coming with each breath, it's a good idea to take your baby out of the carrier. Even if it's a bouncy seat or a swing or a car seat, as we said, you always want to remove them. And then you can try again with proper positioning, making sure that chin is up off the chest. Also, on that note, you want to make sure in a baby carrier that the fabric properly supports the spine to prevent slumping in the carrier, which will also help protect the baby's airway. So that's rule number 1, protect the airway. Rule number 2 is don't drop your baby. Right, sounds obvious. But really what I just mean is you want to support your baby with your hands while you're getting your carrier on and secure. And then once you have your baby carrier on, you want to make sure that it's on properly, that it's supporting the baby as it's designed to do. If you're learning a new skill, like a back carry for instance, it's a good idea to have another adult there to help spot, and you can even reduce the risk further by practicing maybe kneeling on a bed to help minimize the risk of falling. So keep the baby's airway open, don't drop your baby. That's really all you need to remember. And if you're following those 2 simple rules, then you are doing it right, no matter what carrier you're using, no matter what carrier position you've chosen. If you follow those rules, then you're doing it right and your baby is safe. Another thing to think about is just using common sense when choosing what activities you can baby wear while participating in. For example, you never want to wear your baby while you're driving in a car or riding in a car. A carrier is not a proper substitute for a vehicle safety seat. So that's one thing. Anything in general that requires safety equipment for either the adult or child, it's not a good idea to participate in while baby wearing. Additionally, some people ask themselves, would I do this while holding my baby in my arms? And oftentimes the answer can be the same if you're thinking about doing it while baby wearing as well. Asking yourself these questions can be a good help in assessing the risk and deciding whether it's something that you should be participating in while baby wearing. So thank you so much for watching and enjoy wearing your baby.